on the web, and in your hands. This is MDiTV.
Recent headlines about widely prescribed antidepressant medications could have you looking around for a pill to cure confusion. The New York Times headline says popular drugs may help only severe depression, while ABC News reports antidepressants, placebos near equally effective. USA Today, antidepressant lift may be all in your head. And there were more, taking the same study and spinning it in different ways. Is the problem that the science is just too complicated to explain? Not really. Here's what it was all about. Researchers wanted to try to sum up the results of large trials that randomized some people with depression to treatment with antidepressants and gave others placebo pills. That's the best way to be confident that any difference between the two groups is really connected to the active medication and not just the passage of time or other factors. The researchers included 6 trials in their analysis. Their conclusions were fairly straightforward. Treatment did provide substantial benefits to people with severe depression. But for people with mild or moderate symptoms, the benefits may be minimal or non-existent. But there's a reason the study authors said maybe. Because what they really pointed out is that the big trials included very few patients with mild or moderate symptoms. So there's just not much evidence that's truly relevant to most people who seek out help for symptoms of depression. The researchers specifically pointed out that all those TV, newspaper, and magazine ads that reach out to people with less severe symptoms don't really mention that the drugs were tested almost exclusively on patients with unusually severe symptoms. They also noted that there may be studies out there that were never published in medical journals because they didn't produce exciting results. So were the headlines that dismissed antidepressants as no more effective than placebo correct? And should people with mild or moderate depression toss their pills? A number of clinicians reacted to the news coverage by saying, no, don't do that. And indeed, there is a difference between saying something doesn't work and saying there's little evidence that it does work. Unfortunately, for people with mild or moderate symptoms of depression, the message is that despite more than a 20-year history of prescribing antidepressants and the onslaught of ads promising relief, we simply don't have good scientific evidence about the effect of these pills on most of the people who take them.